This episode of the Curious About Cannabis podcast is brought to you by you, our dedicated listeners and supporters. Thanks to your continued listening, sharing, and donations, we've been able to continue the show free from third-party advertisers and sponsors. So, thank you. And if you'd like to learn about other ways you can support the show, visit patreon.com/curiousaboutcannabis.
I'm Dr. Mary Clifton, and we're going to talk about cannabis.
The Curious About Cannabis podcast is produced by Natural Learning Enterprises, a mission-driven company dedicated to enhancing critical thinking skills and public scientific literacy about life in the natural world. If you like Curious About Cannabis, consider checking out some of these other learning initiatives by Natural Learning Enterprises.
Come on, Molly! It'll be an adventure! Phoebe called out as she followed Brother Toadstool. Brother Toadstool led Phoebe and Molly into a tunnel that went deep down into the ground. As they climbed into the tunnel, they found themselves getting smaller and smaller and smaller.
Our new children's book, A Toadstool's Treasures, takes young readers on an adventure into the fun and fascinating world of fungi. Learn more and find mycology-related learning resources, games, and lesson plans for teachers and homeschooling families at toadstoolstreasures.com. Biodiversity loss due to habitat loss and fragmentation is rapidly increasing around the world with devastating consequences. Learn how you can help contribute to native habitat corridors in your community and reconnect with your wild neighbors at gardenwild.org. Oregon recently became the first state in the United States to legalize the medical use of psilocybin. As cities all over the country begin to decriminalize the use of entheogenic plants and fungi, it's time to have a serious discussion about psychedelics. The Serious About Psychedelics limited series podcast is coming soon. Learn more at seriousaboutspsychedelics.com. You can learn more about Natural Learning Enterprises at naturaledu.com. And now, back to the show. Hey everybody, this is Jason Wilson with the Curious About Cannabis podcast. Thanks so much for tuning in once again. So today I'm really stoked to be joined with not only a doctor, but a really awesome educator. I'm always excited to talk to other educators. I'm here with Dr. Mary Clifton. Thanks so much, Mary, for being willing to come on the podcast today.
Oh, thank you for inviting me.
Yeah, totally. I'm really excited to share your story and to give people some context. Mary and I recently became colleagues under the Institute of Cannabinoid Medicine, which is a recently launched group with several other names that I'm sure some of our listeners will recognize. But it looks like we'll get to have some opportunities to do some teaching together and developing some educational content. So really excited about that. But I wanted to take this opportunity to just kind of introduce people to your, kind of unique story, because you're on the East Coast. And so a lot of the folks that I talk to are on the West Coast, and there's a very different dynamic between the areas as far as medical cannabis and recreational cannabis goes. So I guess to kick things off, do you mind sharing with our listeners that are less familiar with you some of your background and kind of where your clinical focus is?
Oh, sure. I did, I'm an internal medicine doctor. I've been practicing internal medicine for almost 25 years now. And I got interested in cannabis and CBD after I had a couple of significant, impactful experiences on hospice patients, one of whom was my own brother, who died of colon cancer and had a very complicated and uncontrolled death with a lot of, difficult symptoms at the end of life. And we never really got great control over them.
Yeah.
And then shortly after that, I took care of another person that I loved a lot, a good girlfriend who died with cannabis as really her primary medication to manage her conditions around the time of her death, and ended up she had a much better outcome, nowhere near the level of uncontrolled symptoms. Really, actually, shockingly good control compared to all of these years of hospice management that I've done as an internal medicine doctor. So then I started to look into it and realized there was probably a lot I didn't know, and probably a lot that a lot of other people didn't know too. So that was 5 years ago, and I've been in cannabis ever since.
Wow. And can you elaborate a little bit on what you noticed as far as how cannabis contributed to your friend's quality of life in those last years?
Well, sure. I mean, at the end of life, there's so many different issues.
Hmm.
There can be nausea and weight loss, loss of appetite, some shortness of breath symptoms, pain symptoms are very common, and all of those can be oftentimes pretty difficult to treat under usual circumstances. So a lot of that went poorly treated and poorly controlled for my brother, who really died out of step. He was in his early 50s when he died. So it was a situation where you just don't expect to be dealing with all of these end of life issues at that point. And
Yeah.
so part of, I think, what made his death so complicated was that he really hadn't dealt with all of those types of issues. He was, sick and dying, but also having like a lot of psychic
Mhm.
concerns, a lot of anxiety and depression, and concerns about what was going to happen with his kids and how his
Mhm.
wife would be for the next many years that she was alive without him. So a lot of those concerns, I think, are really difficult to manage without the right
Yeah.
kind of counseling. And I think especially for people who are sort of out of step with that, with their dying process, when it happens at the wrong time in life, it's really important to get the right counseling and get
Mhm.
those people, feeling as comfortable as they can be with the transition. So I felt like a lot of that didn't happen in a really logical, intelligent, stepwise pattern in that particular circumstance. But then just a few months later, when one of my girlfriends developed a recurrent ovarian cancer process and was going through her process, with cannabis in place, she had a remarkably smooth transition. And I mean, they're different people. She was
Right.
probably at her baseline much more aware of the patterns of life, and maybe could adjust a little bit better. But her adjustment was so much better with cannabis in place that I started to think about what it might be possible to do for all kinds of people. And actually now thinking about mushrooms and psychedelics and
Mhm.
how amazing psilocybin is for this end of life experience, and for people to be able to see themselves on a continuum, or see themselves as, fingers on a hand with all other life. Those things are remarkable things that some people have a very difficult time seeing, and can get a chance to visualize with some assistance with some of these chemicals. So we're really lucky that our planet just gives them to us.
Yeah, and I'm glad you mentioned the psilocybin thing, because when you started talking about hospice, that was one of the things that really came to mind. Especially at the forefront here in Oregon, because we're voting on whether to allow clinical use of psilocybin. We're also working on decriminalizing all drugs, which is sort of an interesting thing that we're tackling all at once.
It's
But
fascinating, isn't it,
it
that
is,
that's
and
happening?
it is. It's happening faster than I expected it to. I definitely expected psilocybin to be the next push after
Hmm.
cannabis in Oregon, but it happened way faster than I expected, which I'm excited about. It's something that I've studied and been interested in for a long time. When I was in undergrad, I initially was prepping for medical school to be a psychiatrist, because I eventually wanted to find a way to study not just psychedelics, but sort of the psychedelic class of compounds, these serotonin like compounds that tend to have like very profound effects on consciousness. And then sort of ended up changing gears, going the natural products route and getting stuck in labs. But um, but
It's
it is,
always funny how life takes you on a track. I mean, I
it
did,
does.
15 years of practice in a primary care solo practice and just took care of people, got their mammograms, did their pap smears, like made sure the diabetics had good blood sugar control. And then at some point you just sort of look up and go, well, now wait a minute. Like, is this
Yeah,
really my life mission? Is this what I'm supposed to be
yeah.
doing? And when it isn't, you do have to figure out what that transition is going to be and try to do it as gracefully as possible.
Yeah, I think that's the key, the grace of it all, because yeah, sometimes when you take that step towards, sort of this follow your bliss kind of thing, when you take that step, you don't always know where you're headed. And so I think maintaining that grace is one of the hardest aspects
That's really
beyond just
true.
taking steps. Yeah.
And
And
sometimes I think what you think that the system needs or what you think you can
mm,
contribute ends up being different than what is actually needed or what you do end up contributing.
absolutely, yeah. Sometimes the models you've built in your mind about the systems that you want to be involved in, as you get involved with them, you realize they're different than you conceived, and then your whole worldview changes a little bit, and so that sends you on. And uh, before, was your experience with cannabis use in hospice, was that your first exposure to like your first direct exposure to the medical use of cannabis, or
Oh, I
did?
mean, in my practice over the years, people would have me do their card or
Oh,
offer,
sure, yeah.
some opportunity to, talk to me about cannabis or talk to me about a grow that they were getting involved in. But all of it seemed, I mean, on myself when I was in high school, did my body weight in cannabis. I mean, in retrospect, I had a tremendous amount of untreated anxiety, and it was at a
Sure.
time where if you had a problem with anxiety, you were just supposed to deal with it. It
Yep.
wasn't really like a diagnosis that anybody took seriously, and we didn't go to therapy or anything. I mean, I grew up in, the backwoods in way up in northern Michigan, so it wasn't really a situation where all of that was recognized as a
Yeah.
problem. So I did have a lot of anxiety and I felt a lot better when I used cannabis, but also I didn't really have control over, what type I got or,
Hmm.
exactly what was going. So you just got whatever was available. I don't think we really recognized even different types of products that we could get.
Oh,
And
yeah.
so I had a lot of paranoia develop as like a unfortunate side effect, but I did really enjoy being able to relax when I was using it. And nowadays there's of course all kinds of other mechanisms to manage relaxation and getting regular therapy using CBD for people like me with a license that doesn't tolerate cannabis use. But there's so much value for so many people who can access these products and be able to take advantage of of all of these great effects.
Yeah, and it's you bring out something really important. I think that a lot of folks that are, roughly around my age and older, because I kind of fell in that same time period, and I also have severe depression and anxiety. So there's a lot of self-medicating in my past too. That is sort of how I got into studying pharmacology and chemistry and things, trying to understand why these things, were affecting me and what was going on. But growing up in the deep South, once again, a big stigma against going to see a therapist. Oh, you're seeing a psychiatrist? Like, what's wrong with you?
Hmm.
And so there are all these dynamics there that and it wasn't popular at the time to do things like yoga and relaxation techniques and all these different types of tools. My wife is a mental health therapist now, and there's all these tools she has to train people to, react to stimulus differently and all these different tools. But yeah, when I was growing up, that just wasn't really ever talked about or acknowledged seriously. And so I think there's a a big demographic of people right now that have gone through a similar thing, that maybe had anxiety issues, depression issues, whatever, and self-medicated with cannabis, maybe in their teenage years or their college years or 20s, whatever, and then maybe never um, quite understood why it helped or anything like that. And now we're in this age of information. I mean, I keep telling people there's like a tidal wave building of cannabis science research
Oh my
coming
gosh.
out every year. It's a bigger push. I mean, 2020 has been the biggest year yet for cannabis research publications, and the next year will probably be the next biggest.
Yeah.
And so it's exciting that, you're out there now teaching people how to understand what cannabis is doing to the body and its appropriate and inappropriate applications and things. Because I'm sure there are a lot of light bulbs going off in people's heads that have done the exact same thing. Like, oh, yeah, I was anxious when I was younger and I did use cannabis and never really thought about it.
Yeah, it's this whole chicken and egg thing. Like, they'll say that people that use cannabis have, higher levels of adult anxiety and
Right.
depression. But then if they used it in their teen years, but then, so were they using it in their teen years as a
Hmm.
medication, or were they in fact already anxious and depressed and realizing it and managing their symptoms because,
Yeah.
they were in an environment where other people weren't really listening or didn't really understand how to help them. So, and we'll never have the study where we take
Right.
10,000 young people and put half of them on cannabis and half of them without, and then see, how that all plays out. So,
Yeah.
to some degree, you really do have to rely on the comments from people who
Mhm.
used cannabis when they were younger to be able to say, I was handling the situation, the best I could with the tools I had. And so there's probably that, and there's probably also some experimentation, just some simple
Mhm.
experimentation of young people where you just want to try new things and see what everything is all about. But cannabis is a shockingly safe product. I mean,
Yeah.
we have, what do we have now? Something like 3,500 years of recorded history
Yeah.
where it's been shown to be used for, it looks like way back when, for abdominal pain and nausea
Mhm.
or loss of appetite, mostly abdominal symptoms. But there's nobody yet who's been born with three eyes after having had an exposure. We certainly can't recommend it in pregnant or breastfeeding women, and we can't recommend it in young developing brains. um, but we have to recognize that really anything we use in those circumstances, we have to be very careful,
Yeah.
because every drug, even the ones that have been approved by the FDA, have side effects and could have potential side effects on a developing young brain.
Yep. Yeah, and it's always a risk benefit analysis, particularly in pediatric care, because you're right. Like, I mean, I've spoken with other doctors that deal in pediatrics or that deal in like women's health that do have to deal with you know pregnant mothers that are using cannabis and everything, and it's the way they describe it is just like with any other medication. It's this very sensitive, delicate risk benefit analysis where you look at the health of the person and the possible consequences and you work through that. But that's the case with any medication whatsoever. um, and so it's kind of important to keep that in perspective because we're still kind of wading through the I guess some of the knee jerk reactions from previous decades, and how they would talk about cannabis use broadly, where it's just always no, always prohibited. And I'm sure, like, even having a medical license, like, I'm sure your hands are tied sometimes in what you can do because you're still working within this model of having to kind of walk a tight line.
Yeah, yeah. I mean, that does make for a short conversation when the conversation is just say no.
Right, right,
You're
yeah,
not.
and there's no education, you don't get anywhere. um
Yeah, but then when you start to look at the studies and you get great results with anxiety and depression, you can get some pretty remarkable work done within tics and Tourette's,
mhm,
and that community, the tremor and
yeah.
abnormal motor movement community, Parkinson's disease, and then of course there's all of the muscle spasms, the multiple sclerosis team that
Mhm.
just such a remarkable result with using cannabis that it's obviously a drug that's very effective in a number of different realms. So it's exciting to continue to add to the research, but it's probably not a time to wait for the research to
Mhm.
give you some particular data on your particular condition. It's just if you're curious and you think it might work for you, it's probably time to get a quick consult with whatever the
Mhm.
condition is that you're dealing with and see how you can use the product to your benefit, or which, and at this point, I mean, it makes me laugh after having been a kid way back in the 80s and trying to figure out how to acquire some and how to,
Right.
just,
Yeah.
I mean, gosh, it was just whatever you could get. And nowadays you're like, I don't want something that's going to rev me up too much, but I want something that's going to keep me a clear head because I want to use it in the morning when I'm anxious,
Yeah.
or I really want something that's going to help me sleep really deeply and not only manage my anxiety, but knock me out a little bit. And so, well, I'll give you one for the morning, one for night. Try it like this, take it with this mode of administration. This is hilarious. This is
Yeah.
a totally different environment, and really speaks to the fact that this is a real, honest to goodness drug with pharmacologic effects that that work in different personalities and in different people different ways.
Yeah, absolutely. And it's something I'm really interested to see is the eventual development of tools that'll allow us to better measure some of the correlates of someone's physiology, to understand things about the endocannabinoid system, the endocannabinoid dome, and be able to take it to the next step of like, okay, we can understand your personal sort of profile, and we can now understand better how the chemistry of a particular product might interact with that physiological profile, which I think we still have a little ways to go, but it seems like there are companies now focused on that, at least from a genetics level, trying to understand certain genetic markers that might make someone, for instance, sensitive to THC. I've seen some companies working on that. It's incredible to see how far it's come. I mean, sometimes it's I laugh in my head all of the time because the same way. I mean, I just remember having to uh, just hassle somebody on the phone to see if they had any, and then when they do, you got to go right then and try to get it, and then all of the anxiety about just trying to make sure you make it home safely without
Yeah,
getting arrested.
acquisition. Oh, I know. Like if you kids only knew, it was like
Right.
walking to school, uphill both ways.
Right. Yeah, exactly. Yeah.
It was
And
really.
in your experience with patients, what are some of the most common conditions that you're seeing that people are wanting to turn to cannabis for?
Oh, I think my particular practice follows sort of the rules of the road. I mean, most people
Mhm.
are looking to manage anxiety or
Mhm.
pain or sleep disorders. That makes up 70% of the people that are
Mhm.
coming to cannabis. And I think that's great because when I was in my private practice, seeing patients, I'd have to see you back every 3 months for
Mhm.
management of your depression or anxiety. And then, I was in control of all of that.
Mhm.
Either whatever one of those conditions I was dealing with, you had to come back to me and get your refills. And if you skipped an administration, then you could have a lot of side effects, dizziness,
Yeah.
headache, all kinds of stuff. So having it really takes the control away from the patient.
Yeah. Yeah.
And then, I felt like everybody was always just handing their health care to me, and being able to enable somebody else to be in charge of their health care was something that I could almost never do. All of our training was really just to be an intermediary to the pharmaceutical industry. I mean,
Mhm.
I sometimes felt like a vending machine at the end of a long day. I mean, a usual day would be 16 patients, but if it was flu season and everybody
Yeah.
was coming in and
Yeah.
out of my office, it'd be 20, 25, 32 patients a day. And then you're just running these Tamiflu scripts and,
Mm.
repeatedly saying the same thing. And it's very transactional. People
Mhm.
come
Yeah.
in, they have a blood pressure issue. They don't want you to tell them to eat differently or move their bodies. They want their prescription for their diuretic or their ACE inhibitor. And
Mhm.
then the blood pressure goes down and everything just keeps right on rolling. So
Yeah.
that's what I did for years, is just hand people their blood pressure pills and their cholesterol lowering pills, and 4 or 5 years later, they'd have a heart attack or they'd have a cancer. And it was kind of the way that life was supposed to be. This was the
Yeah.
way that healthcare was delivered, and this was my patients' expectations. But when I talk to people about cannabis, It's so much different because, if you have a bad day, if you're in pain, if you're really anxious, you take more. If you are
Mhm.
having a good day and you feel fine, you don't need to take any at all. There's no withdrawal if you don't
Right.
take it. And over and over, studies will support that if the patient's in control, they take a
Yes.
lot less medicine.
Yep.
And so, once people can get out of the mode of just tell me what to do, I just want you to tell me what to do. Once they can really embrace that control and take it back, then you can have really great outcomes with these products.
Yeah, and you're highlighting this move that's been sort of percolating in the healthcare world for a long time, which is individualized medicine, individualized
Hmm.
healthcare. And so one thing that I wanted to ask you is when you were sort of in that mode of kind of doing the same thing over and over again. I mean, it does sort of program the patient to not think about their own health that much because they're just coming to you and taking what they need, go home, that sort of thing. But at any point, did you ever think, is this what I went to medical school for? Like I learned so much and I like have this ability to critically think and, you know, really tackle hard problems and now I'm, just kind of like going through the
Oh,
motions.
yeah, I thought that all the time. I mean, sometimes I just felt like I was standing here with an armload of crutches, and people would
Yeah.
come in with a busted ankle and I'd just throw a crutch under their arm,
Mhm.
like
Yeah.
I'm not eating properly, I'm not moving, I've got blood pressure and cholesterol, but it's hereditary. Everybody thinks that everything that they're
Mhm.
dealing with is because, their mother and their father have it and their brother has it, but they're all like living the same lifestyle.
Lifestyle.
And
Yeah.
that was really driven home to me again, as if it needed to be when during pandemic, because my mother got sick and I was home taking care of my mother,
Mhm.
and eating the same foods from my childhood and adding weight and getting more arthritis pain and having more trouble just getting through all of the things I needed to do during the day, a lot less
Yeah.
energy. And once I was able to separate myself again and get back on, my typical meals and the way that I move my body, it emphasizes again that I don't think that any of this, I mean, I think possibly 10% of this is genetic. I mean, I think the way that your body falls apart if you
Mhm.
mismanage your body is
Yeah.
genetic.
Yeah.
Like if you're a Galbraith, you're going to have a heart attack, and on the way, you're going to get very heavy and deal with a
Mhm.
lot of arthritis. If you're on my father's side, you tend to be more cancer. They don't necessarily gain at the level that the Galbraiths do, but if they don't take care of themselves, they get cancer. And so, but the ones that do take care of themselves live really
Yeah.
long lives and do well. So there is some genetics to what part of your system is going to break down. But in terms of this being like just a natural thing with aging, that we all just get
Mhm.
sicker and
It's
unhealthier.
inevitable. Yeah.
Yeah. So I spent a lot of time thinking about diet and exercise and talking to patients about lifestyle modification, which is really a hard sell. And after many years of trying to do that, I was like, I just got really tired of it. And then I thought, where really is my impact here? Where is my
Mhm.
mission here? Because it's probably not in continuing this little practice for a few people. And
Yeah.
so I set it down, and then started to think about, what other really amazing tools are out there that people are underutilizing.
Yeah. And so what did that transition look like of starting to think about cannabis consultations and education and everything more seriously? How did that develop?
Yeah, I mean, I did my own hospitalized patients the whole time I've been in practice. So I went into the hospital for a while because it's reimbursable and it gives you a lot of time off.
Yeah.
when you're
Mhm.
in the hospital, you're working insane hours, but when you're not in the hospital, you're
Right.
not in the hospital.
Yeah.
So and then I had this experience with my brother 5 years ago. And then I started to really think that there's so many people that could take back their health and not need
Mhm.
to be reliant on prescription therapies anymore, and be able to, be in control again and
Yeah.
feel better and not have all the crazy metabolic side effects that so many of these
Mhm.
medications have. So the more I explored that and the more I looked into that, I started to shoot videos. I started to
Mhm.
just shoot 3-minute videos that instead of being like, here's a study on multiple sclerosis, I would look at all of the available data on multiple sclerosis, create a 40-minute video, and then pull excerpts out from
Mhm.
that 40-minute video to make 3-minute videos for my website. And I did that for all kinds of diseases and just kept working on that in the background all the time. And now I have like 100 videos and about 10 hours of these deep educational videos. And then we decided it was really time to develop a coaching community around those
Yeah.
educational videos, that we need really an army of people that understand how to use cannabis and are able to deliver it to their communities. So that's how all that came to be.
Nice. Yeah. Yeah. Just a natural progression. It reminds me of a lot of my work with the podcast and everything. I tackle sort of a very different side of cannabis than you do, but it's very similar in that I put together these podcast episodes. I take clips out that I think are very, informative. I try to talk to experts in the field as well as patients and stuff to share perspectives. And now it's grown to, I was looking at it the other day and I was like, oh my gosh, I've got like months of content here. Like if someone were to just watch, all of these interviews and all of these excerpts and everything, it all of a sudden becomes this huge thing. And so where I'm at now is like, how can I organize all of this around topics like pharmacology or, uh, cannabis safety, all these different things. So I could totally relate. I totally relate to that sort of organic evolution um, of content making and everything. One thing that's on my mind as we talk about the use of cannabis and sort of finding it as the safer alternative that doesn't have the severe withdrawal symptoms and stuff as a lot of medications. How do you conceptualize how cannabis fits into an overall I guess, healthy lifestyle? Because through talking to multiple doctors, a common theme is that you, like you mentioned, that when you feel good, you don't necessarily need it, and you don't take it, and you don't want cannabis to necessarily become another crutch. And so, a lot of the doctors that I've talked to say that it's really about um, while using cannabis sort of as a stepping stone to teach patients how to think differently about their health, about their diet, about their movement, and all of that. So, how do you conceptualize how cannabis fits into an overall sort of lifestyle model on how to optimize health?
Oh, I really think of cannabis, CBD, CBG, CBN, all of the different cannabinoids as potentially some of the most powerful adaptogens, especially
Yeah.
now when we're all under so much pressure and stress. We have all of our usual pressure and stress, and then we have, the pandemic that has just
Yeah.
quadrupled everything, and everybody is always on edge. So having something that can help you to relax, all of the mushrooms that turkey tail and the
Hmm.
ashwagandha, very powerful adaptogens. But boy, you can't underestimate the value of imprinting memory and managing trauma, even this collective trauma that we're all
Hmm.
experiencing, managing it in a way that's going to imprint it in a very safe and effective way in your brain. Because I think a lot of us, as we go back on this experience of this, supercharged fall that we're dealing with, and these rising cases,
Hmm.
and just so much fear, it's going to be a time that you can definitely imprint memories in a really negative way that are going to impact you for the rest of your life. So having some tools that allow you to, relax and engage in a very safe way and allow your brain to properly take in fearful experiences, but then
Hmm.
add the appropriate layers of emotion,
Yeah.
through this prefrontal cortex, and then put those memories away through the hippocampus and the amygdala in very safe ways is critical right now. I don't think that anybody should be dealing with an endocannabinoid deficiency right now.
Yeah, yeah, and my wife is already seeing the effects of this year. Just mental health communities, particularly out here, and I'm sure everywhere, are seeing record caseloads,
Yeah.
and not just basic, I say basic, but not to underplay it, but basic anxiety and depression, but like serious, yeah, trauma responses, PTSD, like symptoms, really heightened anxiety, panic attack disorders. And it's gonna, we talk about it a lot, but like this is just the beginning of a trickling out of effects from, the intense sort of adrenaline sustained states of being that a lot of us have been in this year.
Mm.
um, it's going to be a while before we totally wrap our arms around what exactly has happened and just how it's affected people. But I know that the effects are definitely very serious already. And on something that you just mentioned, talking about the pandemic, I think it'd be worthwhile to um, take a moment to talk about um, cannabis and its effects on maybe the immune system. And a lot of people have questions about how cannabis might affect COVID-19, how it might affect someone's chances of catching any disease, that sort of thing. And I know the research is sort of all over the place right now because it's also new as far
Hmm.
as COVID-19 goes. But can you speak a little bit to um, how people should think about their cannabis use in a time where they're worried about catching this virus, and if they
Yeah.
have the virus, how's it going to affect symptoms and that sort of thing?
Immune modulation,
Yeah,
absolutely. The immune modulation related to cannabinoids. I think my favorite study to support that these products are going to be particularly effective right now is the immune modulation it was in a rat study,
hmm,
and usually I don't do a lot of discussing about rats because
sure.
or I make some snide remark like this is generalizable to attorneys or like that, depending on the crowd I'm in.
Right, yeah,
but this
it's
rat
true.
model study is really a pretty valuable study. It was a cage full of rats, and half of them got CBD pre-treated, and the other half didn't, and then they were all exposed to the flu, to rat
Hmm.
flu, and then the group that was exposed to CBD prior to getting the flu didn't get as seriously sick from the flu.
Mm,
They still got sick,
hmm,
but they were still able to eat and drink more food. They were even interested in playing in their mazes and running on their little run circles, whereas the other rats got the exposure and were just really down and out, sick and laid out and not able to eat or drink and not
yeah,
interested in playing. So it was a big difference, and it was a difference enough that it reminded me, and I'm sure makes you think about like when the flu is coming through town. And some people are just laid out in their bed sick as a dog, and other people are going back and forth to work. They're kind of managing. And that's what we're dealing with now with this pandemic. We just have so many people that are getting sick, and it's sort of an unexpected thing. Which person is going to get sick? You really need to be able to manage your immune system response to this infection. Your immune system needs to, of course, fight off the infection, but not create some, overcharged super response that leads to a whole bunch of mucus accumulation in your lungs and just an excessive immune response. So the immune system response needs to be balanced. And
yeah,
how to achieve that balance so that you can achieve survival from the infection is a $1 million question
yeah.
nowadays. So that's very exciting review that you can see cannabis modulating the way the body is responding to influenza virus. Obviously,
Hmm.
it's not coronavirus, but we have data on the cannabis affecting the immune response to hepatitis, which is, of
Hmm.
course, another virus, and West Nile virus, influenza virus, and one other somewhat common viral infection that's escaping me right now, but quite a bit of good research showing that it can modulate the body's response to viral infection.
Yeah, and it ties into the adaptogen piece that you were talking about, because a lot of people may not realize that sometimes, and it's kind of become highlighted with COVID, with the cytokine storm stuff that people are now learning about. But a lot of times, um, what kills a person sometimes with a disease is not the disease itself, but the body's response to the disease if it overreacts. And so sometimes when we think about immunosuppression, we think of that as a negative thing, like, oh, that's gonna make you sick or get you sicker or something. But sometimes immunosuppression can be a very good thing if what you're trying to do is prevent your body from having this overreaction to this foreign invader that's coming to your body. And it reminds me of, there's a CBD study on anxiety and stress that showed a similar response to stressful stimuli, that people that were exposed to CBD before a stressful event tended to have lower blood pressure, lower heart rate in the presence of that stimulus
Hmm.
than the
Yeah.
controls, which is, it's really fascinating. It just highlights this. I don't know. I'm not a fan of the word homeostasis because a lot of times it gets sort of twisted out of its intentional meaning, but it is sort of that kind of
Balance. It's
balancing effect. Yeah.
just a restoration of balance, a restoration of balance where balance wasn't existing before. Yeah, my favorite study about anxiety is about a group of college students who were dealing with generalized anxiety disorder, and they invited them to this study, and then treated half of them with CBD and left the other half alone, and then gave them an IV and an MRI, which is
Yeah.
just two horrible things to go through.
Yeah.
But both of them, actually led to really great data because it was a functional MRI, a PET
Yeah.
scan.
Yep.
So you could see how the blood was moving in the brain and how the brain's response to the stressor was impacted by having CBD in place or not. Very elegant study, even though it was a small study,
Yeah.
and definitely showed really nice responses, much improved results to management of stress and anxiety when CBD was in place. And in a group of kids who had anxiety disorder to where they were having a hard time going to class.
Yeah.
So and impacting their social lives, impacting their college experience. And this was, just a single dose of CBD, but absolutely at every 30-minute interval measured at 30, 60, 90, 120, the full, 3 hours worth of evaluation. They reported reduced anxiety and better able to manage the stress, and their brains manage the stress better.
Yeah.
So we really do have some powerful products here for so many people who oftentimes need more help than I think we're willing to recognize.
Yeah. I think, that's the critical piece, that we're willing to recognize.
Yeah, because oftentimes it's just like, you're fine, right? You'll be
Yeah.
fine.
Right.
Yeah, and then
And people manage themselves, their outward appearance, so well sometimes too. Like I'm sure both of us know from having anxiety that it's sometimes, even though it takes a lot of energy, it's becomes a tool that you present yourself as fine. And you a lot of times don't express what you're feeling or that you're having a hard time for whatever reason, and you just try to blend in while you're just secretly suffering.
yeah, I think there are a lot of people who are in that situation for sure.
Yeah. And are there, a question I always like to ask physicians that I talk to, are there areas of application that you see cannabis not being appropriate for, or sometimes
Mm.
maybe contraindications and that sort of thing?
Well, there are probably some tremors where it's not providing as much benefit as we think it is.
Yeah.
There are some circumstances where people are getting benefit, but the benefit is really primarily from managing the anxiety surrounding the condition rather than actually managing the condition. So there are some pretty powerful Parkinson's disease studies that show that there really isn't a change in the intensity of the tremor that people are dealing with the Parkinson's, but that their anxiety and the sleep disorder that commonly happens with Parkinson's is controlled. And so sometimes the benefit of this medication or how this medication is working is not as entirely clear. And there are a lot of cases where we're not going to see, large multi-center population, trials where we're looking at 10,000 people, because you're looking at millions and millions of dollars. And it probably isn't appropriate at this point. We know we have a safe product, and if you want to see if it will work for you, it's very reasonable to talk to somebody and get some advice and give it a try. It's a really intelligent starting point for managing a lot of conditions that you might not have control over. But some tremors, I think, may not be very well treated with them with cannabinoids.
Yeah. Yeah, and you just touched on something that I talk about a lot, that the issue with the clinical trials around cannabis. A lot of them, as you mentioned, are relatively small samples, um, and a lot of people wonder, like, when are the big cannabis studies going to happen. And you've now highlighted multiple reasons why that's challenging. One is the IRB approval. So, like you were saying,
Hmm.
with kids, like, it's going to be a little hard to get a review board to actually approve a study where you're giving kids cannabis, and that's
Hmm.
just the way it is. Observational studies, that's a little different, because then the person's doing what they're doing, and you're just documenting what you notice, and go from
Hmm.
there. But actual controlled study, before you can ever step into a clinical study, you've got to get IRB approval, and that's not always straightforward, especially with something like this. But also, yeah, the safety profile of cannabis is very well established. At least the safety profile of herbal cannabis and basic cannabis preparations. I always put like an asterisk there, because we're moving into a world of all new products that, like, kind of fall into a unique category. We don't have thousands of years of sort of trusted information about that we can probably trust, but we still need to kind of understand more about. But herbal cannabis, basic tinctures, that sort of stuff. Um, we understand the safety profiles, and something we haven't directly talked about, but that you're sort of alluding to, is and I may screw up the technical terminology here, but what's it called? Like self-reported titration, where essentially a patient is able to, uh, either through with their healthcare professional or by themselves, titrate themselves based on how they respond, and build themselves up and down, which you don't have that luxury with a lot of drugs.
Hmm. I mean, we have to too just get away from the randomized controlled trial being this gold standard, and that
Yeah.
you're not going to work with a drug or think about using a drug until you have this multi-center randomized controlled trial, that we need more data. And you keep holding that up, because that's going to hold up a lot of valuable
Yeah.
intervention for a lot of people. And the reality is, population-based studies have been safe and valuable for us for years and years and years. Like, if you believe that you should sleep because
Hmm.
sleep works, or if you think that you should eat vegetables because vegetables help
Hmm.
to reduce your risk of cancer, or fractures, or all of the things that they do, and help to maintain an ideal body weight. If it appears that relationships are valuable to you, and maintenance of long-term relationships
Hmm.
will help you support a happy, healthy lifestyle and potentially prevent disease, if you believe any of those things, that's all population-based data. That's
Yeah.
because we followed 40,000 people over 30 years, and we
Hmm.
said, you know what, it looks like people that maintain relationships and eat their vegetables and get their sleep and move their bodies, do well,
Yeah.
compared to people that don't. We are never going to take, 40,000 10-year-olds and put half of them on a Twinkie diet and half of them on a healthy diet, and then come back and be like, oh my God, it turns out Twinkies are not good.
Maybe, yeah, maybe 150 years ago.
Yeah, yeah, maybe, and probably in certain populations. I mean, oh my God, some of the stuff we used to do, it was like, how unethical can we get? Let's do that.
Yes. Yeah.
That was
Yeah. It's
welcome to medicine in the 60s. But
exactly.
nowadays, that's not, and it doesn't need to happen. I mean, we know
Hmm.
certain things associate with a healthier lifestyle. So the same thing is true with these cannabinoids. You don't need to wait for these big studies. And most of the people that are doing the hard work and the research, a
Hmm.
lot of it coming out of Israel, really, they're doing small studies,
Hmm.
small, very valuable studies that show benefit, and then they're building from that small study,
Yeah.
based on thousands of years of population-based data showing safety and efficacy. So, that's, we just have to back ourselves away from this.
Hmm.
And the randomized controlled trial, I think the reason they rose to so much popularity was that, they can only be done by large pharmaceutical companies. They're the only ones that have the money.
Yeah.
So it really concentrated the power in the medical industry into large pharmaceutical corporations.
Yep.
And as we wrestle that power away, we're going to find more and more that we just have to embrace and adopt different ways to explore new measures to control our health.
Yeah, and something that has me a little nervous on the hemp side of things is, you know, even though hemp is now legal and technically the cannabinoids and chemical constituents of the hemp plant are legal, the FDA still has not classified any cannabinoids as generally recognized as safe. And sort of on one of the hats I wear professionally is in quality management and compliance consulting for producers and analytical labs. And something that a lot of people aren't aware of is that if let's say that the FDA decided tomorrow that, okay, we're going to treat CBD and all other cannabinoids from hemp as a dietary supplement, which right now they've been very resistant to doing. If they said yes, immediately a lot of people would think that's a great thing. But if they haven't designated it as generally recognized as safe, then what that then does is it makes it where every company has to get what's called self-affirmed GRAS status, where you essentially get a FDA stamp of approval on your particular product or product line or ingredient or whatever, and that takes millions of dollars to do. Usually, it takes at least $1 million, and so I'm very nervous that we might step backwards a little bit pretty soon once the FDA kind of wraps their minds around what to do with hemp-derived cannabinoids and CBD and everything. And I don't think the market is prepared for that potential reality that it seems like they're poised to unleash.
I wonder if they will. I just there's this is really at its origins a weed. It's a very I'm not going to say very easy to grow because I can't grow anything or keep anything alive, but I mean a lot of people can grow this pretty easily. It's not particularly finicky, at least certain strains, and
Right.
people do really really well with it. And there's the seeds are already widely dispersed. It's going to be, I mean, they might be able to rein it in and start genetically modifying everything, but I don't know. There's such a groundswell against all of that already. It could go the way of corn and beets and so many other large crops. I'm hopeful that it won't. I think
Yeah,
there's
me too.
always going to be a really powerful, valuable place for a whole plant, and which is something that I love about this product is, we can subdivide it, and I think it'll be wise for us to do that, to take particular products out of the whole plant and concentrate it for valuable use in cancer or in particular inflammatory conditions like Crohn's disease and ulcerative colitis. There's some nice strides happening there. But by and large, a lot of people get great results from just using the whole plant, and it's such a wonderful natural thing to do. I think that will always be there.
Yeah,
We're going to have some pharmaceutical products,
of
and
course.
two, but we've just got to really work toward legalization in a way that that where we can move quickly and try to get some things locked in that expunge records for people who are in jail for it, but also, render it something that people can use safely for managing their conditions. I mean, let's face it, everybody's losing their health insurance, and our economy is bottoming out soon. There's just no way that it can't. And we're going to need to regulate this product in order to extract the tax dollars from it, and we're going to need to do that quickly. But people are going to need to get some medicine. I mean, I practice a lot of telemedicine, and we can function as a stopgap for you for 3 months, for your cholesterol lowering therapy and your blood pressure pill or your antidepressant, but after 3 months, you really need to see your doctor again. But, then I have people write back and say, I can't see my doctor. I don't have any health insurance. I don't have $200 to go see my doctor and then another $70 to pick up my medicine. Then you got to figure out something else. And there's a huge number of people. There's millions of people that are going to need powerful natural remedies.
Yep. Yeah, absolutely. And I agree. I think that certainly like the whole plant cannabis space, I do see that persisting into the future. And maybe if the FDA does end up taking a hard stance on the commercial products, maybe that just ultimately drives people to explore the plant, themselves more, to experiment with cultivation and making their own products and stuff. Who knows? That would be kind of a nice future to see, because there's also therapy in just growing something.
Yeah.
Just taking care of a plant can be extremely therapeutic. One thing I wanted to shift gears a little bit to talk about something that is on a lot of people's radar now, talking about hemp, which is CBG. Have
Hmm.
you done much reading into some of the available research and clinical applications of CBG, and can you speak to how it is similar or different to CBD? Because that's mostly how a lot of consumers are comparing it right now. Is just trying to figure out how does it compare to CBD?
Yeah, I try to avoid talking a lot about test tubes and petri dishes, and a
Hmm.
lot of what we know about CBG, or what we think we know about CBG, is test
Right.
tube and petri dish information, and not
Yep.
really like human beings and how human beings are responding. But even with that said, CBG does appear to be a very powerful immune modulating cannabinoid, more so than CBD or CBN or
Hmm.
CBC or any of the other ones that are, relatively easy to isolate and
Yeah.
present in high enough levels that we can actually isolate and study them. So there's certainly some value to thinking about CBG for immune modulation, especially now. A CBG infused CBN is not a bad thing to think about putting in your medicine cabinet for this winter, just to give yourself that potential for further immune modulation.
Hmm.
I think that as we see the pharmaceutical industry step up and have a bigger role here, they'll
Yeah.
probably be doing some CBG concentrations for particular immune conditions like the Crohn's disease or ulcerative colitis. That might be a place where we see a CBG, a G infused or a CBG prominent product, have an important role.
Yeah, yeah, absolutely. And I think it's very important what you pointed out, that so much of the research around CBG right now is all, mostly in vitro stuff. So it is very hard to draw any conclusions about that. Which is, I've had mixed feelings about CBG kind of rushing to market so fast because of that. It's just like, I don't know anything. It's hard to say much about it without getting, really deep into speculation. um, but from what I've heard from people that are now taking CBD that have reported it, some of them have said that the stimulating effects of low doses of CBG is more powerful than CBD. Because I've had several people complain to me that they can't sleep when they take it,
Hmm.
um, which is interesting. And then I've had a couple people tell me that it seems to help them with gastrointestinal issues. But once again, I'm like, I can speculate on why that might be, but just don't really know much yet.
Yeah, yeah, and I don't have enough individual. I mean, I do think if you're in this industry for enough time and you talk to enough people, and you treat enough patients, that you can start to say my professional experience. Like
Right. Yeah.
a doctor who's like possibly 30 years old probably can't say that, but when you get into a doctor who's 50 years old and they've been
Yeah.
seeing patients for 20 years, their medical experience from medical school is still pretty fresh in their minds, but they also have seen a lot of patients. They can start to say, my expertise would suggest. Um, and so, but I haven't seen enough people who have been on a CBG enhanced infusion to where I can, tell you anything
Hmm.
particular about it other than what I've read in the studies. It's just fairly new to be using those products. But I think we're going to see some nice immune modulation in the future.
Yeah. Yeah. Definitely. And to start to wrap things up, because we've been talking for almost an hour now, I really, really appreciate it. I wanted to ask you, what do you see on the horizon for you? Kind of what over the next couple of years do you have planned, and and to tack onto that, what has you kind of particularly excited about the future?
Well, I think really the key to cannabis getting anywhere is going to be education. I mean,
Yeah.
very simple educational tools in the middle school and high school level that get us away from reefer madness and drug war type philosophy into thinking about having conscious conversations about products that you're using and how those products could be impacting you and your friends. Having conversations with your parents about safety for different products. And that's probably going to be a two-way conversation in
Yep.
those communities where people are educating in both directions, you know.
Yep.
So I think those are the education is very powerful in that community. But we're also going to need to have people ready to talk to anybody who's ready to bring these products into their life. So I developed this cannabis coaching community that I am just absolutely obsessed with. It's so much fun growing it and talking to people and helping people have the data that they need to be really successful in talking to people and also having products that they can sell. I don't personally have a product, but if I can, work with my community and offer them products that are high quality and valuable, then they have the tools that they'll need to, to give their community a leg up and give them some extra stuff. Like, for example, I just introduced to them a hemp pre-roll that works really well in people who need to chill out more urgently.
Right.
And rather than taking a tincture, you can take a few inhalations from what very much looks like a cannabis cigarette, like a joint, except it's hemp. And so you get all of the relaxation and the relief from the hemp instantly from that inhalation. That's really helpful for breakthrough anxiety symptoms, for, autism that is having a breakthrough. You want a product that's going to have a fairly immediate impact to help relieve symptoms. So those have been a huge hit in this coaching community and a great thing that they can offer all of the people that they're working with.
Yeah, totally. And something you mentioned that I'm particularly excited about too is facilitating this conversation with younger people. One of the first interviews I ever did, technically the first interview, although it wasn't the first episode, but the first interview I ever did for the podcast was with a friend of mine that does health and wellness education, particularly with high school students and early college students around drug education and that sort of thing. And one of the topics that came out of that interview that has been on my mind a lot that I'm looking forward to doing some work on is facilitating a discussion with teenagers and their parents around what does responsible cannabis use look like? What does adult responsible use look like? And of course, talking about, what do we know about how cannabis affects the developing brain and all these things. But I think that especially as cannabis is being legalized in so many places, or medical cannabis is being legalized in so many places, I think it's very important for us to have this broad discussion of, like, what does responsible use look like? We have conceptions of what responsible alcohol use looks like, to some degree. But we're not really having that conversation with cannabis very much. What does too much cannabis use look like? What does, what forms of cannabis might be more harmful to your health than others? All sorts of different things like that I think can make a profound impact. I know personally, just from friends of mine, a story that I've told before, but I had one of my best friends back in high school. His relationship with his mother got very compromised because she found a bong in his closet and didn't know how to react, so she called the police. And so
Oh, God.
he woke up with a police officer standing above him and had a whole series of things. And where I'm from, in my little town in rural Mississippi, if you get arrested for something, then all the police know you, and then they start to watch you and target you from that point on. So I've had several friends that have left my hometown simply because they get harassed by the police constantly. But, I look at just that example and I'm like, gosh, like, she didn't have to do that. Like, there was a conversation to be had there that could have, really steered that situation in a better direction.
Yeah.
Yeah.
But I
And so,
mean, then people just automatically go to this place that the child is, in danger, and that this is a gateway drug, and that you're going to, move
Yeah.
to these higher level drugs. So you have to nip this in the bud, and all of that is patently untrue. There's
Yeah.
no evidence that cannabis is a gateway drug, and there's no risk of reefer madness any more than there's a risk of any other. I mean, people do show up in acute psychotic breaks
Hmm.
after having used cannabis, but it's at the same rate, or at certainly at the same levels when somebody uses cocaine or even alcohol in a
Hmm.
predisposed brain. So there's situations like that where people definitely should not be using the product because it can enhance a process that's already in place.
Yeah.
And boy, I just talked to a fellow at a conference recently who his daughter had a psychotic break, and he was, really upset about that particular comment from me. But then when I asked him if she had ever had any auditory or visual hallucinations before the break, she in fact had. She'd been
Yeah.
having these hallucinations for a while, and he was like, "Well, what do you think that meant?" And well, it meant that she was at risk and really shouldn't have been using any substances until she saw, somebody who
Yeah.
could help her manage what was probably an early schizophrenia that had gone
Hmm.
undiagnosed. And so there's, any substance could have pushed her into, the next steps with her psychiatric condition.
Yeah, exactly. You have these what they call precipitating events for mental
Right.
health issues. Yeah, and what I often tell people, having learned from my own battles with depression and anxiety, but also from my wife's work, that it can take until year 25 or so before underlying mental health conditions sometimes really make themselves known. And so it's kind of a sensitive time. And yeah, if you're experiencing any um, either positive symptoms or negative symptoms, flat affect, or different things like that, it becomes a much bigger gamble to experiment with anything that influences your consciousness in any way, because um, it just takes that bit of stimulus to be that precipitating event, no matter what it is. And it doesn't even have to be a substance; it can be a trauma, it can be all sorts of different things, experiences. But yeah, that's one of the areas where I see that the education with kids can really be valuable, and help people either avoid a bad experience, or be able to conceptualize that experience and understand what's happening and be able to get help in a effective, efficient way. Um, and so yeah, that's all super super exciting. Well, I want to be respectful of your time. I know I'm sitting here rambling as we go over an hour, but thanks so much, Dr. Clifton, for being willing to talk to me this long about cannabis. I know we'll have tons more to talk about, and I'm sure through TIOCM we'll end up doing some interesting things together, and hopefully facilitate some of these kinds of conversations that need to be had with people. So
Oh,
yeah,
yeah, absolutely. TIOCM is going to be great for educating people. And then, of course, I have my own, coaching certification to check out at the Cannabinoid Protocol, a very supported coaching community that provides a lot of mentorship and helps you to achieve the goals you want to achieve within the cannabis space. So if
yeah.
anyone's interested in that, I'd love to hear from you. I'd love to work with you. And of course, any clinical questions, we have people standing by ready to answer those for you too.
That's perfect, and that leads me to my to kind of my sign off here. Um, to close out the episode, I want to hand over the platform. Let people know your website so they can learn more about the cannabinoid protocol, and really anything else that you want to share with the listeners. Any resources you want to connect them to, or any last thoughts as well, to kind of wrap things up. I'll basically hand over the podcast to you.
Oh, thank you. Yeah,
Totally.
the Cannabinoid Protocol coaching program is nearly 50 videos of all kinds of topics, all of these, 40-minute videos that I've prepared for people to learn about how to use cannabis and CBD for anxiety, insomnia, chronic pain, movement disorders, autism, like we've talked about, but also gut health, seizure, cancer, immunity, metabolism. lots of different tools for people. And then we have regular meetings with a very high level of support, and then products that you can sell to your community. But if you're interested in only a small portion of that, or if you're just interested in affiliating so that you can sell products, we have all of those systems in place for you. So, you can be the Amway or the Herbalife of CBD and cannabis in your neighborhood if you want to. I'm happy to help you with that.
Nice.
But
Yeah.
yeah, it's just very important, super important that we have hundreds, thousands of people quickly out there spreading this word and helping people to feel better. Some of these ancient pieces of wisdom for healing die away if they don't get honored at some point. And we have to really respect and honor the people who have carried this wisdom forward for us so that we can spread the word now. Because we did almost lose it in 100 years of prohibition. So it's time now for cannabis and CBD and psilocybin eventually to reach the status and prominence that it deserved and should have had all along.
Yeah, I couldn't put it better myself. That's perfect. All right. Well, everyone listening, thanks so much for tuning in and checking out this conversation. Don't forget to, on YouTube, look up Mary Clifton, MD, and you'll find a lot of her free videos as well. And you can learn more about her work there. And if you want to learn more about Curious About Cannabis, you can check us out at cacpodcast.com, or you can find us on Facebook, Instagram, or Twitter. And we mentioned the Institute of Cannabinoid Medicine several times. That we're still working on getting the website all massaged out and everything for that. We just launched very recently, but if you want to learn more about TIOCM, you can go to tiocm.org. Thanks so much for listening. Stay curious and take it easy. Bye-bye. If you want to learn more about cannabis, check out the Curious About Cannabis book on Amazon.com and other major online book retailers.